What is air trapping in cystic fibrosis imaging? Air trapping in cystic fibrosis imaging refers to the retention of air in certain parts of the lungs during the process of breathing out. This phenomenon is visible on chest-computed tomography scans, particularly during expiration. When a person with cystic fibrosis exhales, some small airways can become blocked. This blockage prevents normal deflation of lung segments, leading to localized hyperinflation or gas retention in areas beyond the obstruction. On expiratory computed tomography scans, air trapping often appears as a mosaic pattern. This pattern indicates small airway disease, which is a key feature of early lung involvement in cystic fibrosis. The areas where air is trapped do not show an increase in density during expiration. In contrast, healthy lung tissue typically shows increased density as it deflates and loses volume. Research shows that air trapping can be quantitatively analyzed in children with cystic fibrosis. It correlates with the severity of structural lung disease and ventilation issues. For example, increased ventilation heterogeneity can be measured using the lung clearance index. However, it is important to note that air trapping does not always mean there is measurable hyperinflation. Other factors, aside from airway obstruction, may also contribute to this imaging pattern. Longitudinal studies that use automated analysis of computed tomography scans indicate that air trapping can change over time. It may even precede or be linked to the development of irreversible lung damage, such as bronchiectasis. This underscores the significance of monitoring air trapping as an early indicator of lung disease progression in cystic fibrosis. In summary, air trapping seen on imaging for cystic fibrosis is a sign of small airway obstruction. It leads to incomplete emptying of the lungs during exhalation. This imaging finding is crucial for diagnosing and monitoring the progression of lung disease in individuals with cystic fibrosis. Always consult healthcare professionals for personalized medical advice and to understand the implications of imaging results.